Great. So welcome to our activist teach-in. Our focus today is going to be on thinking globally and acting locally. Next. So the purpose of our time together is a lot of us in the United States have been really focused on kind of some national initiatives in activism. And I've been thinking a lot within the last year about kind of where I live and where I'm sick and where I'm well. And obviously we all live in a country, but when I think about kind of the space that I navigate my life in, I live in the United States, but if I drill down, I live in New York State. I live in particular in New York City, and I live on the Upper West Side of Manhattan. That's where I live, that's where I eat, that's where I sleep, that's where I'm sick, that's where I'm well some days. So it made me really think about kind of local activism and kind of really drilling down to make sure that the people in my community, in particular my neighborhood or my city or my state, are aware of ME and are in the position to help provide services. So when I think about the idea of think global, act local, this phrase was originally used in the context of environmental activism. The idea was that you really couldn't wait for global legislation or global action to change something. So the best course of action was to drive change yourself locally. So when you think about environmental activism, there's a lot going on in the world, but it's kind of hard to kind of make an impact on that big a scale. So if you think about environmental activism, some people decided that the way that they contribute to making the earth as healthy as possible is they started recycling programs in their neighborhoods or even in their building or even in their home. So think globally and acting locally has now taken on a much wider meaning and use, and it really urges people to consider action on a variety of issues in their communities. So the ME community can greatly benefit by adopting a local philosophy of activism, because ME activists live in communities and have the skills and the motivation to facilitate change at the local level. Next slide. So our speakers today are Elisabeth, who's from Norway. I'm a big fan of Norway. I think that they've done some amazing things for the ME community. And then I will be sharing a story of New York on some recent successes that we've had with a letter that went out to every physician in New York State, as well as a relationship that I have brokered with my New York State senator. Next slide. So Ben's helping out today. Unfortunately, my computer decided not to work with me this morning. Elisabeth from Norway will be giving the first mini presentation about some of the successes that has happened in Norway. So Elisabeth, take it away.
Thank you, Terri. Hello, everybody, and thank you, Terri, for asking me to do this. I thought I'd share a little bit about our journey planning a certified course for medical doctors about ME. So I'm guessing a lot of people are struggling to find a doctor who really knows ME well. And we have the same problem here in Norway. There's a lot of great things happening here, but we also have all the same problems as we do everywhere in the world. So I'll sort of share this story from my point of view. So next slide. There we are.
And
So this
Elisabeth,
is me. Yeah.
sorry, Elisabeth, before you start, I felt like we have a little background noise. So if somebody's on the phone who just joined, if you could please mute so we can control for background noise. Thank you.
So this is me when I was 6 years. I was really healthy and really lively. And then when I was 15, I got ME, and I got really, really ill. And nobody knew anything about ME at that time. So this was in 1991. And it took me 15 years to get a diagnosis. And that's some of the reason that I do what I do with ME activism, and I'm also leader of local branch of the Norwegian ME Society, because I really don't want young boys and girls to go through what I went through at the time. So 15 years later, I got the diagnosis in a different country than my own. So actually in New Zealand. And then it would take another 17 years before I was able to attend a course about ME at my local hospital in Tønsberg. That's the town that's nearest to where I live. And I was a little skeptical about this course, thinking, I'm not sure they know much about ME. What's this course going to be about? Next slide. So this is a hospital local to me. So this is where people now get their diagnosis. And this is also where they have now courses about ME 3 to 4 times a year. So 3 to 4 groups a year go through this specific course. So next slide. And we are very, very lucky. The woman in the course is a nurse, an ME coordinator / nurse. I think we only have 3 ME nurses in Norway, and we are lucky that we have one of them, a really amazing woman. And she works in the local community. She's now seen over 1,000 people who either have ME or are relatives of people who have ME. She's been to visit the seriously ill in their homes, and she runs courses for patients, for relatives, for professionals. She also has conversations one-to-one. She's doing a really amazing job. And in the county that I live, there's about 240,000 people. So I estimate that we are maybe 500 to 800 people with ME in the county. Next, please, Ben. So this is the course that I went through in 2013. This is the place where they run the courses. The topics, they run over maybe 7 to 8 weeks. So it's one day, 2 hours each time, and they have good breaks. They also have beds where you can lie down, or recliner chairs, so that people are able to attend. Obviously, only the mild and moderate are able to attend, but it's a really good course, and the ME nurse is really well qualified. So they go through the medical aspects of having ME. They go through movement and energy economics, and what I mean by that is how you can minimize your energy consumption by doing things differently, so moving differently, so economizing your energy, basically. Then they have psychological aspects of having a chronic illness, and also they talk a lot about techniques to help you in your everyday life. I do a little talk about research on the actual course. We have people who have actually been on the course come back and do talks. We talk about diet, and there's also information from the patient associations. And then the most important thing we do is we have dialogue and we share experiences. And when we have evaluation at the end of the course, that's always the most important to people, is to meet other people with ME and see that there are many, many people living with ME, and be able to have talks with them and exchange what it's like to have the illness. Next. So I attended the course in 2013, and in November 2014 the course was over. So some of the course participants were really worried because they had bonded with the group, and they were really worried that what happens when this ends. So we made a suggestion that we continued to meet after the course ended, and the hospital was very gracious and lent us a room in the evening, and we set a date and a time, and we met once a month. And then after a little while, this little group decided to officially become part of the Norwegian ME Association. So next. So the Norwegian ME Association is a patient organization where we have about 4,000 members countrywide. And the head office is located in Oslo, and we have a lot of local branches, so little groups in their own counties that run ME meetings and talks and such. Next. So this is Norway, the long, thin map there. And these two counties, I live in Vestfold County, the one to the right on the screen, and Telemark County is to the left. And if you see on the map, you see the tiniest yellow piece on the map. That's Vestfold County, not that one, the big one. The tiny little yellow dot there, yeah, that's one. That's Vestfold County. So it's a very small county, but it's got 240,000 people. And then Telemark County is the turquoise bit, just next to the yellow bit. Yeah, that's the one. Next. So we worked really hard the last few years to, this is the Vestfold country branch, to get more members on board, and we to also get more board members. So these are the board members this year of 2017. Really great group. We have about 190 members in the Vestfold, and we arrange meetings every month, and we also have talks and courses, and we cooperate very well with our local hospital. Next. So this is one of the courses we run for relatives of ME patients. That's something that we're quite that we do quite a lot, and also we do it together with the local hospital, because it's very important to us to get the relatives involved in ME work. So, but to do that, they need to know really what ME is about. So we have an evening, maybe 2 evenings in the spring and 2 evenings in the autumn, where we have a course for relatives, and it's quite popular. We usually have 4 speakers: the ME coordinator nurse, 1 patient, 1 relative, and 1 representative from the ME Association. And the course runs between 3 and 4 hours. Next. So now we get into the collaboration. So the Norwegian ME Association hosts a seminar once a year, and it runs over 3 days, usually Friday, Saturday and Sunday. And representatives from the main office and local branches, they meet, and we have presentations, we talk together, we look at our how we run things. And in 2016, representatives from Telemark decided to they wanted to collaborate with us in Vestfold. So we actually had a little meeting at the seminar, and they proposed that we should look at creating a course for medical doctors. And both Telemark and Vestfold already collaborate well with our local hospitals. So we started talking. Next. And there were two key people that from the hospitals that made this possible, and that's that in Vestfold we had a ME coordinator nurse. She works closely with the hospital locally, and she has a great knowledge of the ME community. And then we have a doctor in Notodden Hospital in Telemark who has worked with ME patients for a long time. She's also a leader of the multi-center study Retox ME at Notodden Hospital. So if there's some of you don't know what Retox ME is, that's the multi-center study we do in Norway at the moment. It should be finished in October, testing rituximab on ME patients. So there's 5 hospitals who are part of this. Thanks. So we had some meetings where we talked about what speakers and what topics did we want to include in this course for medical doctors. We also contacted different medical doctors and asked them what did they need from a course like this. What were the areas that really they wanted to hear about. And we also worked on how to get the course certified with the Norwegian Medical Association, because we wanted doctors to get credits for attending, so that is more attractive for people, for doctors to attend. Next. So this is what we decided on as topics. So diagnosis, a lot of the doctors looked at this illness and they sort of wanted a shopping list. What tests do I need to do? What specialists does this person have to see to be able to set a diagnosis? We also wanted the doctors to get updated information about the illness. We wanted to talk about the challenges that having ME poses. We wanted to look at the newest research, medication, rehabilitation and work, how that works for the people that are on the milder end of the scale. We also wanted to talk about existing courses that can help ME patients and best practices, things that have been shown to work well, so good examples. And then we wanted to talk about children and youth with ME. Next. So these are a few examples of some of the speakers that we're going to have speaking at this course. There might be more, we're not sure yet, but we have some really great people. So the first speaker is, and some of you might guess at who they are, but she's doing amazing research on ME, completing her research project now. She's a doctor, doing a VO2 max test and looking at how blood lactate decreases more rapidly after a previous exercise challenge in people with ME, more rapidly than healthy people. She's working at the hospital, the University Hospital in Oslo, and she's also leader of the multi-center study Retox ME at her hospital. And oh, I lost it there. And speaker number 2 works with rehabilitation. She's a leader at the Sørlandet Rehabilitation Center. They have a program for ME patients. Next. Speaker number 3 is a pediatrician, and he is a leader at the Children Youth Clinic at a hospital in Bergen. He has also done research on long-term follow-up of premature children with epilepsy and focusing on neurology. So he's been working on diagnosis and follow-up of children with ME for almost 30 years, but especially for the last 7 years. So for the past 3 years, he's also worked closely with Fluge and Mella and the research they're doing in Bergen. And he's actively involved in that. And his goal is to improve diagnosis and follow-up of both children and youth with ME, and also to help their families. Next. Speaker number 4 is our ME coordinator nurse. She has worked closely with a lot of patients, so she had a lot of hands-on experience. And speaker number 5 is a doctor who holds a PhD in epidemiology and social inequality in health. She's a doctor that's worked closely with ME patients, and as I said, she's a leader at Telemark Hospital for the Retox ME study. Speaker number 6 is a physiotherapist. She has a lot of experience with ME patients and a really good understanding of the illness. Next. So the course will take place in October 2017, so this October. This is the venue. It's a really great spa hotel conference center with its own spring water. So it's really, really nice. The doctors can stay on and swim and things after the course if they want to. It's an 8-hour course that they're attending. We will evaluate the course after it's completed, and we're hoping to possibly offer a 2-day course in the future. And so this is very exciting for us. So this is what we're doing in our little tiny part of the world. Thank you very much.
Thanks, Elisabeth. And we'll just give, and there's your contact information if folks want to contact Elisabeth after the Blue Jean call. And we'll just give Ben just a few minutes to kind of switch over the next slide deck. Great, thank you. So again, welcome everyone. I'm Terri Wilder, and I'll be giving the next presentation. So next, please. So I'm going to be telling a New York ME activism story. It's not the New York ME activism story, but just one. Next, please. So I'm originally from a state in the United States called Georgia. So if you look on the left-hand side of the screen, you'll see that red state. And for those in the United States, you know what a red state means. It's a very conservative part of the country. So I was born and raised there. But then in 2009, I moved to New York which is on the right side of the screen for those of you watching online. And one of the reasons why I moved here is because I'm not a very conservative person. I tend to be a kind of a liberal personality. And I also felt like that there would be more opportunities for me in New York because the economy was better and there were more jobs in my field. Next slide, please. When I compare the difference between where I was born to where I live now, in Georgia, it's the southern part of the United States, and people are very, very obsessed with football. And so we do a lot of conversations about football. We do a lot of picnics before and after football. And so up at the top of the screen is the logo for the University of Georgia, which is where I got my education. And we're called the Georgia Bulldogs. So that's just a logo. How about them dogs, which is referring to the football team. And of course, the picture in the lower right-hand side is a picture of New York City, which is very different. Lots of buildings. The Statue of Liberty, of course, is an iconic symbol there. So there's a very different way of kind of looking at the world and how things happen or don't happen, depending on what part of the United States you live in. Next slide, please. I really consider myself from 1989 until recently kind of 100% in terms of activism and HIV activist. I started volunteering in HIV and AIDS, like I said, in 1989. I am trained as a social worker. I have 2 degrees in social work. So it's very much kind of a part of not only how I was trained as a professional, but it's also very tied to who I am as a person through my family. My great-grandmother was an activist. She advocated for women's right to vote. She actually ran for the United States Congress. She did not win. My grandmother started a learning disabilities group because both of my uncles have learning disabilities. My aunt is a bit of an activist in terms of the death penalty in the United States and environmental issues. So there's a lot of history of activism in my family. On these pictures at the top and left, you can see me screaming and yelling. And that is us in front of Trump Tower, which is where our President Donald Trump has his main residence in New York City. And there's just some other pictures from different events and rallies and protests that I've been a part of. So, like I said, for 25 plus years, I've always defined myself really as an HIV activist. Next slide. And in my professional life, I'm the director of HIV education at a very large hospital in New York City. Here's a picture of me giving a presentation at a conference. At the upper right-hand side, I'm sitting at a very special program in New York City in which the governor is releasing a plan to end AIDS in New York State by the year 2020. And if you can see me in the picture, I'm sitting next to a very famous AIDS activist named Peter Staley, who's one of my best friends. We were both appointed to the governor's task force to end AIDS in New York State by our governor. And the yellow image in the far right hand is actually the blueprint that we helped create that really is a roadmap to ending AIDS in New York State by 2020. Next slide. But then in March of last year, my life dramatically changed. I was diagnosed with ME. I suspect that I've probably had it since 1996, but really started getting very, very sick in 2014. And of course, like many of us, it took us a long time to figure out what was wrong with us and to figure out who to go to get diagnosed. Next slide. As I started thinking about my diagnosis and how do I get help, I started thinking about living in New York State, and I could not find any resources in New York State. I really couldn't find, any kind of recognition of a system of care that included social services or anything like that. And because I do, I do a great deal of work with the New York State Department of Health in HIV, and my organization is funded by them. I have a lot of contacts at the New York State Department of Health. In my team on May 6th of 2016, just a few months after I was diagnosed, we're putting on our largest conference of the year in Henrietta, New York, which is in the upper state of New York. And I had invited the New York State Department of Health AIDS Institute director to give a keynote address at the beginning of the conference. And as I was sitting there listening to him speak, I thought, this is a man who has a lot of power in state government. And while I don't have HIV, he's in my space right now. I invited him to speak at a conference that I coordinate. I wonder if he could help me, even though I have ME. So when he got off the stage, I went up to him and asked him, how long was he going to be able to stay at the conference today? And he said that he was going to be able to stay through lunch. And at that time, I asked him, could I have a private conversation with him or maybe even eat lunch with him? And he said yes. So I sat down with him at lunch and I disclosed to him about my new diagnosis and about being scared, not knowing what this meant for my future, not knowing if I was going to be able to keep my job or my medical insurance or what was going to happen to me. And I told him that I had done a lot of research on the internet, looking at the New York State Department of Health website, looking at the New York City Department of Health website, and that I could find nothing on my illness. It's as if it didn't exist. And I told him that there had to be some kind of department in New York State that addressed my illness. There just had to be. So he said that he would look into it and help me. He got back to me, said that there was a division in the New York State that it should fit under. So he set up a phone call for me. During that phone call, they basically told me that they couldn't help me because all of their funding was from the Centers for Disease Control and Prevention, and that it was only for cancer and it was only for heart disease. And I laughed because I had been reading a lot, and what I said to them was, well, eventually you'll have to take care of me because I'm probably now more at risk for cancer and heart disease because I have ME. So sensing my frustration, Dan O'Connell, the director of the AIDS Institute, and a woman who works with him, Joanne Moore, both decided to put their thinking caps on. Next slide. This is a picture of Dan O'Connell on the far left. And to the far right is a picture of Joanne Moore. On the bottom of the screen is Karen Hagos. They all work together in the AIDS Institute. So I should tell you that the AIDS Institute doesn't just address HIV. They address drug user health. They address hepatitis C. They address LGBT health issues, and they address sexually transmitted infections. So they don't address my illness. And when they came back to me, they said, we think we have a solution to help you in some way. And I told them that I really appreciated it because, you know, this isn't really their area of expertise or kind of what their job duties are. And I'll never forget what Dan O'Connell said to me. He said, it doesn't matter that we work at the AIDS Institute. I'm a public servant and you need our help. So one of the things that they immediately did was they took one of their interns and assigned her the task of doing an extensive literature review on ME. I had multiple phone calls with them. I invited Mary Dimmock, who many of you may know from the United States, to start participating on those phone calls with us because I wanted certain things to be done. I wanted a website to be created on the New York State Department of Health website. I wanted there a way to not only for medical providers to get information, but obviously people who think they might have ME, people who have ME, because I have a lot of connections in New York State through my HIV activism, but who I worry about is people that have no connections to government or any systems of care to have a place to go get information. So through a course of conversations and emails, Joanne Moore suggested that maybe one way to get things moving was to contact the New York State Health Commissioner's office. So Joanne brokered that meeting, and Dr. Daniel Green, who works with our health commissioner's office, graciously agreed to have a phone call with us. We sent her materials in advance about ME because most people, as you know, don't know anything about our illness, so that she could read in advance of our phone call. We also sent her an agenda. So myself, Mary Dimmock, Joanne Moore, Karen Hagos, and Dr. Daniel Green all had a phone call. And during that phone call, she really listened to what we said about the state of this public health emergency. And she came back to us a couple of weeks later for another phone call. And on that phone call, she told us that the health commissioner had agreed to send out a letter to every physician in New York State about ME. And that this was part of something that he did every month. He has a monthly letter that goes out to physicians, and there's always 2 topics that are covered. And the next one that was going to be released was in May, which happens to be the month that we recognize ME Awareness Day. So it was kind of this perfect unfolding of events. With all the materials that we provided Daniel Green, the health commissioner's office put together this letter. They sent it back to me and Mary Dimmock to review and edit, and we did make many, many edits. We were only given the actual ME content, so we were not given information to edit to like how he introduced the letter or how he ended the letter. So we had the opportunity to edit the actual content. And surprisingly, although we did have several edits, I was very impressed by how well Daniel Green listened to us, read the material, and really synthesized the really important pieces. And I was thrilled to see that they did not push GET or CBT. So here is a copy of the letter. There's also a copy on the ME Action website if folks want to go and actually see it and download it. This is also a picture of Dr. Howard Zucker. The letter went out the very last day of May to over 85,000 physicians. But I should mention that it was also put on a website that can only be accessed by New York State medical providers. So it's not a public website. And that website would then allow the opportunity for other medical providers like nurse practitioners, registered nurse, physician assistants to all be able to access this information. Next slide. The response was overwhelming. The second the letter came out, it got picked up on social media. It literally went around the world. I spent the entire weekend fielding requests for the letter, about information about the letter. I mean, I'm not an unpopular person, but I'm never going to be the homecoming queen at my high school. Like, I was never the person to like be the most popular girl in high school. That all got made up for that weekend. I've never felt so loved and popular in my life. My email exploded, my Facebook exploded, my Twitter exploded. And so it was very exciting to see that people were so excited about this letter. So, of course, I immediately emailed Dr. Green and Joanne Moore and Mary Dimmock and said, we need to have a phone call about the reaction to this letter. People are just going bananas over it. And so Danielle Green, I'm just showing one of the emails that she sent me. At the bottom of her email, not only she recognized that not only was I getting lots of responses, but people started reaching out to the health commissioner's office. And in this email exchange, she said, did I tell you that one of the European ME groups has asked permission to translate the letter into Dutch? So it really had this really amazing far-reaching effect. And what I realized by the response was that when one community does something, people can take that and say, you know, see, look, these folks did this. We should try to do it as well. And it gives people an example and a precedence to get their own communities to do something. Next slide. And like I said, the response was really overwhelming. So these are just two screenshots from Facebook. So one is from it being posted on the ME Action Network Facebook page. And I don't know if you can see, it's a little blurry, but at the time I took this screenshot, over almost 6,000 people had been reached by that post. And 35 shares had happened, and 152 people liked it, and then there were tons of comments under it. I put it on my own personal Facebook page. Again, I'm not the most popular woman in the world. I don't get a lot of traffic on my Facebook page, but there was 122 shares for my Facebook page. I mean, that's never happened to me in my life. So it was thrilling to see that people, you know, really wanted to spread the word about this. And it also made me recognize how desperate we are for something like this to go out to medical providers so that they can be educated. And I will tell you that the health commissioner's office did share that they got phone calls and emails from medical providers who had clearly read the letter, who had clearly, you know, taken the time to take in the information. One of the things that we put in the letter was a link to Jed Brea's TED Talk. And we know that people not only read the letter, but they clicked the link and they watched the TED Talk because Dr. Green told us that they did and commented on it. Next slide. So I just want to close by talking about how everything is about relationships. So you heard through the story about the New York State Health Commissioner's letter. It was about a relationship that I had and that I kind of thought outside of the box, even though the people that I know don't work in ME, because we don't really have an ME department at the New York State Department of Health, or even an organization that addresses ME. But then I started thinking, like, these people work in public health. This is a public health crisis. We need to do something about it. So I'm going to end my time by telling you a short story about another relationship that I have. New York State Senator Brad Hoylman was elected a few years ago to represent a specific area of New York State. And I used to live in his area. I don't anymore, but I used to live in the area that he represented. And I know Senator Hoylman through my work with the AIDS Coalition to Unleash Power. Senator Hoylman is a gay man. He's very passionate about the community. He's very passionate about the area that he is responsible for in New York State. And he's very passionate about making sure that people with HIV don't have their rights taken away. So I met him through my work in the HIV community. And he's always been very, very friendly to me. He has always remembered my name when he saw me at community events, has always like given me a hug and a kiss on the cheek. And so when I was diagnosed with this illness and started thinking about, you know, how do I get attention of elected officials that represent me, he was the first person that I thought of, because I felt like he was very approachable, had always been very friendly with me, had always shown in his role as a state senator that he really cared about people. Next slide. And so one of the first things that I asked him to do was to tweet out on May 12th. If he could just please send out a simple tweet that could go out to the people that follow him on Twitter about ME Awareness Day, that it would really, really help us raise awareness. So on his Twitter account on May 12th, he posted, "Today is International ME/CFS Awareness Day, a devastating illness costing 2.5 Americans their health. To learn more, go to this link." And the link that he put was the ME Action website. Next slide. One of the other things that I talked to him about was if he would work with me to put through a New York State resolution. Without hesitation, he said that he would. He met with me for almost 2 hours one day in his office, and it was actually, he brought it up to me first about having a New York State resolution in which he formally presents information about ME on the state Senate floor. It's recorded, it's put into the Senate public record, other people hear about it. And so he did that for us. It is now up on the official New York State Senate YouTube channel. People can watch it. And that's a screenshot of him to the right here, actually giving it. And to the left is a Facebook posting on his Facebook page with me, Joanne Moore from the New York State Department of Health AIDS Institute, and Dan O'Connell from the New York State AIDS Institute, standing there with the framed resolution. And it was important to me that Joanne and Dan joined me that day because they were very instrumental in everything that has happened in New York State moving forward. Next slide. So that's just a little bit of the story of what's happening in New York State. I'll just close by saying that in a couple of weeks, I will be meeting with Senator Hoylman's office to start drafting out some legislation so that when the state Senate begins again in January, we can have some legislation that he can introduce that in hopes of having a budget line in the New York State budget so that the New York State Department of Health can get some money to address ME. And I have some other ideas about that as well. I'm also working with Mary Dimmock with the New York City Department of Health, and we're working with them to come up with information for them to send out to New York City medical providers and their medical provider communication. So this is my email, which is tlwilder@mindspring.com. If folks want to contact me afterwards to have some private conversations about things that are happening. But I'm going to close here, and we're going to open it up for discussion and question and answer.
I'm muting everyone now.
Great. Thank you, Ben. So it looks like some people are still muted.
If they're muted, they muted themselves.
Okay. Okay, great. All right, great. So we have about a half an hour and just are going to open it up about anything that people want to talk about. You can either direct your questions to me or Elisabeth, or you can just kind of jump in if there's things that you want to share or you want to ask about.
I have an idea, or like a question, I guess.
Okay, so if you wouldn't mind introducing yourself before you start.
Okay, my name is Maria. Yesterday was actually the 10-year anniversary of when I got sick. I'm in Manitoba, and as the question pertains to it, I'll note that I just got out of hospital yesterday because of a bladder infection that threw the ME off and put me even lower than I was. But I was just thinking, because I've thought on and off about like trying to reach out to the doctors in my area to like have some sort of a presentation, maybe through the regional health authority or something. And I did mention it to one of the nurses, and she encouraged me in that. Thought maybe the hospital manager. I'm just wondering, like, how do I put enough interest into it so that, because like when I've tried stuff like that before, it's like, well, I'll get back to you if there's a way to arrange it, and then I don't hear from them again. How do I sort of make that happen? Does anyone have any experience with that?
Right. So I can just tell you kind of what I've done. And then, you know, Elisabeth, you want to jump in because you obviously have a lot of experience with this. But just recently, again, I have some control over this because it's what I do for a living. But I'm over our HIV Grand Rounds program at our hospital. And because I'm in charge of it, I just decided that we were going to do a Grand Rounds presentation on ME for our last one in June. So I invited Dr. Susan Levine to give it. And so I realized that that's different because I work at the hospital and I have control over it. But a lot of hospitals have Grand Rounds, and they want to do that because they want their medical providers to get educated. And a lot of times the hospitals have these medical Grand Rounds programs in their different departments, and they already offer continuing education credit because a lot of times medical providers, that is one of the ways that they keep their license is they have to have this continuing education credit. So I wonder if they're not responding to you positively, if maybe you could go back and say, can you give me the list of the names of people throughout the hospital that coordinate the Grand Rounds programs? Because, you know, the OBGYN department has Grand Rounds, family medicine has Grand Rounds, you know.
Okay, we're talking a smaller hospital here. I imagine Boundary would be like maybe for the whole hospital kind of thing.
So have you asked if they have some kind of Grand Rounds or clinical case conference meeting?
No, I've never actually heard of Grand Rounds, you said?
Yeah, it's just, I mean, it's just a phrase that means you get together and hear a lecture together, and it typically happens on a regular basis. But even if they don't have a formal Grand Rounds program, the medical providers do get together and they have meetings where they review cases together. They have kind of a clinical staff meeting. So maybe finding out what that schedule is and who coordinates that.
Okay. And one other thing I just wanted to sort of follow up on from your answer there, because you mentioned like the CME credits.
Right.
Now, in our area, I believe, or like our province, I believe programs like to accomplish that have to be approved by the U of M for continuing education. And unfortunately, the doctor who I finally found that was able to make my diagnosis formal, possibly one of the only in the province, supports the PACE trials, and he is assistant professor of medicine for U of M. So I'm kind of unsure how to work around that.
Yeah, that's a tough one. Elisabeth, do you have any thoughts?
Yeah, so mine are obviously country specific, but one of the things we find is that it's very difficult to get medical professionals and doctors to be interested. So there has to be some kind of reward, so some kind of points or for them to attend. It's one of the first things we learned. And that's why we needed to get the course certified so that they get points for attending. Now, the other thing is we have sort of unofficially gathered a bunch of people, doctors, medical people of different kinds that are willing to do talks on ME. So you need a health professional to do the talk, really, if you're talking to other health professionals. Otherwise, they won't listen as well as they might otherwise. And where you possibly could start is sometimes they have sort of Monday morning meetings, or something like that, where they have a little section where they talk about topics. So if you could get in there to start with, that might be a start. I don't know if it's the same in America or other places, but you need to do a little bit of research, finding somebody in the medical field who can do the talk.
Okay. Do you have any ideas like where that somebody sort of come from? Like, should I start with some of the nurses that were looking after me that were so interested in it, or
absolutely?
Where do I go?
So if they're not educated already, so what we did was the ME nurse, when I attended the course, had some knowledge of ME. But she was really open to learning more. So the first thing we did was to invite her to attend the Invest in ME conference. And it wasn't easy to get the hospital to agree. But finally they agreed, and then she came with us to the Invest in ME conference, and she also attended a lot of other courses and conferences on ME, but Invest in ME is a big conference, so it provides a lot of information. So that was how she started educating herself more and more and seeing more and more people. So now she's really highly qualified in the ME field. And also we talked online. In Norway, we actually have a list, a sort of a secret group online for people who want to find ME-friendly doctors. I know they exist in other countries as well, where people share, if they have a good doctor, they share the information about how to find them. So you can find a good practitioner. We also share who might be able to do talks or who might be able to sort of come and educate others, so that we now have a fairly good list of people that we can use for conferences or talks or things like that. So just got to start small.
So I'm aware that there's some other folks who want to jump in and ask some questions or make some comments. So if I could I know Wilhelmina, did you want to jump in?
I do. Thank you, Terri. I had several questions. One of which is, let me introduce myself first, of course. I'm Wilhelmina Jenkins. I live in Atlanta, Georgia. My Georgia's a little different from the one Terri described. I think of it as the home place of the civil rights movement, so I think of it as a home for activism. But I have been sick with this illness since 1983. I have been totally disabled since 1987. And I also have a daughter who became ill when she was in high school in 1992 with this illness. My first question is about burnout. In Georgia, just to give a little history, we've always had a lot of activism here in Georgia in the past. There were very large support groups. When I first became ill, the support group must have been nearly 100 people when I first went to a support group here. That has diminished over time. Many people have now joined online rather than being an in-person support group. My own group gave up meeting in person quite a while ago. And for many people, burnout was an issue. People worked as hard as they could, wore out completely, and you just drop off the grid. We have a really good group of younger advocates here in Georgia now, but they're exhausted. They're trying to carry too much, and it's taking a toll on their health as well. What we need is healthy allies. I was wondering if anybody had had success in getting healthy allies, because we have never had that success throughout the community. I've worked nationally on advocacy since about 1991, and we've never had the ability to pull in large numbers of healthy allies in the same way that the AIDS movement did. So I just wondered if you had any clues as to how to get healthy allies to work with us. The second question I had is, I am in a very blue city within a very red state. It's a very different kind of a situation here in Georgia. We don't have, as far as I know, any large number of contacts within the city of Atlanta. There's been more success in the suburbs in making contacts by some of the other advocates. But here in the city of Atlanta, as I think most people, at least in this country, know, although some and others may not, this is a largely African American city. And we have not had any luck at all in getting anyone to reach out to the African American community with information about this illness. I know the same thing was true of AIDS at one point. I remember Magic Johnson's diagnosis with AIDS was a major break point. But we don't have a major public African American figure who's going to stand up and say, make sure what you have is not this horrible illness, MECFS. We don't have any national image to put out there in particular. No famous person, nobody who's going to catch people's attention. Most of the doctors who work with African Americans here in Atlanta are overworked, to say the least. We do have a strong AIDS community here, but we've never been able to make contact with them in terms of supporting us very well. I wonder if anybody had any thoughts on either one of those two things.
Well, Wilhelmina, I have tons of contacts in the HIV community in Atlanta, so I can definitely broker some conversations. And those people definitely have city council, county contacts that may be able to kind of get introductions and get people with ME and their allies in spaces. So I can definitely help with that since I'm from Georgia. I think the first comment that you made, I think a lot of us struggle with that. And actually, before the call even started, somebody asked about us having a conversation about burnout and allies. And I almost wonder if that is something I need to put on the list for an activist teach-in on just that whole conversation and talking about it.
So
I think that's great.
I might say a couple of things about getting some healthy allies. So relatives, we've recently been quite successful in getting some relatives involved, and that's been after they've attended a course on what ME is. And also they've been inspired by other relatives who are already working actively, doing both advocacy work and also working within the association. So that helps. And also parents is a great resource, and they are very motivated, parents with ME sick children. That's what we've found anyway. And also we try to work we try to have 2 or 3 people working together, so that if one falls off the task, the next one will pick it up, and also do things in sort of relays so that people don't completely burn out.
This is Mary Dimmick. Go ahead, Wilhelmina. I see you coming in. Oh, I guess I'm there now. I was just going to follow on that point, that it might be good to think, as we're thinking about how to bring more healthy allies in, to think about how we can leverage the publicity that we'll get through unrest, because it will bring more awareness in a broader community, not just the parents, but also others who aren't connected to this disease, to get them to possibly care. So there may be a good time to push to get more healthy allies. I definitely agree that we need them.
This is Ben Suborger. I just wanted to jump in here with Mary's and Wilhelmina's and Elisabeth's comments, and I think that's exactly right. One of the things that I, working through ME Action, have been having some conversations with the film impact team about is how we can use the film. In what ways do we want to use the unrest to have an impact on these communities? And one of the opportunities and privileges I've had working with them has been able to be a part of some laboratories with other different filmmakers working on a variety of different social issues, looking at models really of how you use film to bring social issue to the table, impact change. One filmmaker I was recently talking with talked about wanting to use his film to have 3 types of conversations. He said he wanted to have the dinner table conversation among families and friends, and he wanted to use his film to start community conversations, as well as having policy conversations. And so I think each of those we know are really important, but what it emphasized again to me, especially after talking with Elisabeth and some of the successes they've had, is that really what we want to do, we've got to build the ground level of having those family and friends conversations, and that it's only through that we can really build the capacity for some of these higher level conversations as well. So we're talking about things such as toolkits, film impact study guides, ways that you can have an immersive experience with other people, see a narrative, see a story about this, relate to it empathetically, and then come out of a theater and have some tools for a follow-up discussion and where that goes. So I think that in itself will be helpful just for people to understand it better. But also hopefully once people understand the issue better, then that gives us and issues of personal support for people with ME, then that gives us the opportunity to make the asks for people to become allies, and for people to sign on and really support us in, financial, non-financial, volunteer ways. And that's then I think where ME Action can come into the place is through the platform we need to create a set of opportunities and options for ways people can get involved. So one is having the conversation and getting people to understand some of what's going on. And then 2, in a systematic way, asking people to be involved and giving them, easy options for how to start so they don't feel overwhelmed. That's just, there's lots more to think about. And if you guys have different ideas on that, I would welcome you guys to send any thoughts to ME Action. We're still working through a lot of that, but it's definitely on our radar how to use things like the TED Talk, Jen's TED Talk, or the Unrest film, or other public awareness things to first have conversations, and then we got to figure out how to mobilize those conversations into material help for action.
I just noticed I'm seeing Celine's face. Please, did you want to talk about what has happened in the Netherlands with the woman that you were telling me about? So if you'll have to unmute yourself. It looks like you're muted.
That one is first.
Sorry, forgot.
Okay.
Yeah, I would like to comment on what Ben just said. I live in Amsterdam, and we also noticed that it's really hard to tap into the outside ME bubble into the normal community. You know, the people who are your neighbors, who live in the street, the bakery, the butcher, the store, because that's also part of a big city. Of course, we can't forget that Amsterdam has always been about big parties and clubs. You can just forget that these people are going to help us unless you throw a party, which we can't do. We could invite them to do benefits, but I do not find much interest in our own ME community for that. So I thought, okay, how can we make this smaller then, maybe? Instead of make it large and go for the big benefit concert or something, make it really small, like something people can do together. But we are really focused on emancipating the patient because they're so victimized that some, I notice, are also very, even if they're not even, I mean, there are many scales of ill and people can still do a lot, still feel very helpless and insecure. So how can you make them stronger, emancipate? And I believe that by stepping up in public, people get positive attention. And this makes them stronger, like you just experienced that yourself, Terri. We have a great example. 9, almost 17. And she saw us online, and we provided basic materials for to go bird dogging in the street because there were elections. So we had, okay, if you go do this, we send you a set of flyers, put up posters. And she was in fact the only one who actually thought, yes, I'm going for this. So she ordered her flyers with us. We sent it to her. She just went to all the politicians in the street and introduced herself and told her story. And we were all like, this is not possible. For 1 year, we've been trying to call to get through to everyone. And she just walks to the bus with her flyers, says, hello, can I have a word with you? And she tells her story. And then she was advised to go to speak to the mayor because on a local level, the mayor has more influence than anyone else. But before she did that, we were lighting up all the buildings, but we also asked people, like, light up something small in your house if you can't go out. And Mika lit up first her front room. She put a poster on Facebook, like, this is what I'm going to do on the 12th. And then she posted, okay, I have bought 10 light bulbs. I'm going to come in my street, turn the whole street into blue. And she just asked her friends and neighbors also to use a blue bulb at their porch. So now they still have it. I think that's a fantastic initiative because people they become literally aware of, okay, every time they see that, they think about her. They think, okay, how would Mika be doing? And this way, you sort of create your own network of healthy people, but also in daily life, she could ask them to help her with shopping because suddenly they look into her case, they take her serious, also the illness as serious, and they look up the information, so then they literally become aware, and it turns out people are willing to help, just not willing to volunteer on a permanent basis, but they are willing to help with small practical things for a day or something. And we have in healthcare, we have technique. It's difficult to exercise, but also depends very much on the patient. It's called when there's no help for someone, because all healthcare institutions fails or are not cooperative. or you're just not in the system, then sometimes they call it network conferences, and it's based on you invite everyone who's in your phone. So one care worker is going to invite everyone, and you make a list of all small daily jobs that need to be done. And when you have to be driven to the hospital, who can help you with making appointments in case you need that. And it turns out that when they do that, that people actually show up at the patient's house and start to take on those jobs. And it's a step. But if you step up, if you stand up for yourself, you stand up for the community, in a broader sense, this come back. Because this mayor has called all the other mayors. Like, have you heard what's going on? And so the Dutch are not like, okay, today we're going to change everything. It's politicians would have a very hard time saying that. They would never apologize like in Norway, because then it would be probably admitting a failure. But what we do see is that, especially in the regions that we've been sending out a lot of press releases to local radio stations, so we avoided all the big ones. We went for the really small ones. In those areas, suddenly we see circles of doctors having meetings about ME. And yesterday I saw that in an extremely difficult area where everyone's always in trouble with insurance doctors, they invited James Coyne. I saw it online. I don't know how all this happened, but they were like, yeah, we realized that patient get is not working really. Maybe you can come and inform us. And I was falling out of my chair. I mean, and I think that all the small things that people do in small communities, and also to teach them, like, okay, we are your backup. Here's your material. Stand up. And this works quite well for us, I have to say, on all levels. So on a micro level, in a personal life, but also on a macro level and a national level. So I think that we will pursue that method, really. The only thing is it is a bit weak to have to set up network conferences with your relatives when you're one of the richest country of the world, of course. I mean, there should be proper healthcare.
Thank you. So we have about 6 minutes left. And I just want to make sure if anybody else has anything to say who maybe hasn't spoken yet, wants to jump in.
This is Rivka. I could add a couple of thoughts, but I want to give other people a chance. If there's like a queue for people who want to speak, I want to make sure that someone else can speak before me.
Rivka, you should probably go ahead since we only have 5 minutes left.
Okay. So first of all, thank you, everybody. Really, really good ideas. I want to replicate all of them. I just want to say here in Massachusetts, in the United States, we went after a proclamation instead of a resolution. I want to go after a resolution soon, but meanwhile we went after a proclamation, which is a lot easier. The difference between a proclamation and a resolution from elected officials is that a proclamation, at least from what I understand, can just be proclaimed out loud or written, in this case, by one person. And so we went to our governor, so the highest elected official in the state of Massachusetts, and we asked for a proclamation. The governor's office has a staffer specifically set aside just to deal with proclamations. So if somebody wants to proclaim, May 1st, the Massachusetts State Pie Eating Day, the governor might proclaim May 1st, State Pie Eating Day. But so they have lots of people coming at them with requests for proclamations. So we were just one of them. It was no skin off of their back. It was no problem for them to give us a proclamation for ME. The proclamation, we then used that to leverage other things. So the proclamation was no big deal for the governor, but it was a big deal for us, and we used it as an opportunity to get a photo opportunity with the highest elected official in our state house. so in our legislature. And we also sent a press release out to media. So whereas the proclamation was not a big deal for the governor, it was a big deal for us because we leveraged it to get more meetings and press attention. A resolution is different because a resolution is where you have to go to the legislature and everyone has to vote. It's a much longer process. So I do recommend that people try to get proclamations in their local cities or towns or states because it's pretty easy. The second thing I wanted to mention is the importance of using your local efforts to get media attention. It's almost like these efforts are only half the battle. The other half of the battle is to get as much attention for these local efforts that you can. So if you do get some kind of educational opportunity for doctors, you want to then contact the media and let them know. Or else ask the hospital to put it in their newsletter. Anytime that anything happens that can be put in the media, what you want to do. Lastly, last week, we met, or 2 weeks ago now, we met with the Commissioner of Public Health for the state of Massachusetts. And we asked her if we could give her a brochure, a short, like one-page brochure about ME/CFS to give to the community health centers. And we're hoping that can happen. We also asked for a replication of what Terri did, which is getting a letter from the commissioner out to all doctors and hopefully medical practitioners in the state. And one more quick thing, which is that I'm considering doing a teach-in like this, a workshop on how to write your personal story in the form of an essay that you would then submit to your local newspaper. I think that could be really helpful if like lots and lots of people wrote to their local newspapers about their personal struggles with ME. Then at least we can start educating on a very grassroots level. That's it. Thanks, Terri. Thanks,
Great.
Elisabeth.
Thank you, Rivka. So I just want to close our time together by thanking everyone for joining us today. We ended up having about 34 people, so that's pretty amazing. I know it's a struggle a lot of times for us to be on calls this long, so I just want to acknowledge that, and I appreciate everyone's efforts. I want to thank Elisabeth for presenting today. I was excited that you agreed to, so I really appreciate that. And thanks to everyone for coming. I did want to mention that our next activist teach-in will be Saturday, August 12th. So if you want to go ahead and put that on your calendar, it'll be the same time as today from 1 o'clock to 2:30 Eastern Standard Time, which is New York time. The focus will be on getting press, social media, and storytelling as a form of activism. So please save the date and look for an invitation to RSVP in the next couple of weeks. So again, thank you to everyone for joining us today. I hope this was helpful, and we'll hope that everybody has a great day.
Hey, Terri.
Yes.
Thank you.
Sorry, I just wanted to say one more thing to those who are still on the line. Again, thank you, Terri, for putting this all together. And a couple of quick takeaways that I take from this is I think these are like awesome examples that Rivka and Celine and Elisabeth and Terri all gave. And I just want to also offer some encouragement to everybody else that, you may not think what I take away from some of these examples are each person has different relationships and opportunities that are unique at the local levels to take certain actions. And you may not have the exact same relationships or opportunities that someone else has. But we can take inspiration from what people do and to really think about and step back and look at what your relationships are. So you mean if maybe you don't have a relationship with a hospital or with a particular elected beneficial, but there may be other relationships or other places you can start. And I think that's where we really need to encourage each other. That, again, what ME Action wants to be about is encouraging people to take the actions that they can, and that through pulling all these together, we can create something larger. And just one other thing to say is that ME Action is also going through a period of time over the summer. We're looking at what we can tweak and improve to our model. So we think, one of the critical things is the ideas have to come from local volunteers all around the world. We can't be the ones figuring out everything to do and telling you what to do. So it's great to populate all these ideas from all around the world. And we're looking at ways we can be better at helping to share these ideas, document some of them so that it's easier to replicate. And if you guys have particular ideas you want to share about things that you think could be done, or about ways to better just in general share information with each other, please contact me at ben@meaction.net. If you guys have any ideas, we're going to be going through a process of looking at how we can do things better. And we're so thankful to Terri for putting on this teach-in and the others that we'll be doing in August. So I'm really looking forward to that. Thank you.
Thanks, Ben. We'll see everybody Saturday, August 12th. Have a good day.
Thank you.
Thank you.
Bye. See you later.
Bye-bye.
Thank you.
Thank you.